Hello, we'll be studying now about the ligamentum denticulatum. So it is one of the extension of pia mater of the spinal cord. You know, spinal cord gives off four processes or extensions, which are filum terminale, subarachnoid septum, linea splendens, and fourth one the ligamentum denticulatum. What exactly is this ligamentum denticulatum? These are paired ribbon-like expansions or projections of pia mater between the anterior and posterior nerve roots. I repeat, these are paired ribbon or expanded expansions of pia mater emerging out between the anterior and posterior nerve roots, and each ligament presents 21 tooth-like processes which pierce the arachnoid matter and finally is attached to the inner surface of the dura mater between the points of emergence of two spinal nerves. I repeat, ligamentum denticulatum is a ribbon-like expansion of pia mater between the anterior and posterior nerve roots, and each lateral end of this ligament presents 21 tooth-like processes which pierce the arachnoid matter and finally is attached to the inner surface of dura mater lying between the emergence of two spinal nerves. The highest ligamentum denticulatum is located at the level of the foramen magnum, and the lowest pair between T12 and L1 spinal nerves. What is the function of these ligaments or ligamentum denticulatum? It anchors the spinal cord is the number one. It protects the spinal cord, number two. And the clinical importance of this ligamentum denticulatum is these ligaments act like a guide for the neurosurgeons during the operations on the spinal cord, that is cordotomy. If they want to section a sensory tract, the knife should be passed in front of the ligament to relieve pain, and if they want to section the motor tract, the knife has to be passed behind the ligamentum denticulatum. So it is acting like a guide for the neurosurgeons to locate which part of the spinal cord has to be approached. Number two, the last pair of the ligamentum denticulatum, which is lying between T12 and L1, is enlarged and it is forked. Is it clear? The posterior root of first lumbar nerve, this one is the posterior root of first lumbar nerve, emerges along the outer prong of this fork. In fact, this fork of the last pair of the ligamentum denticulatum helps to identify the first lumbar nerve because it is closely related to it, so that the surgeons can count the whatever the nerve roots he want to, because here this L1 is in relation to this fork-like last pair of the ligamentum denticulatum, and from there whichever nerve root a surgeon wants to approach, he can approach. So this acts like a guide for the surgeon to identify the posterior root of first lumbar nerve. The last pair of ligamentum denticulatum helps us to identify the posterior root of first lumbar nerve and acts like a guide for the surgeons to locate the other nerves. Thank you.